Autism in America today, the highest in the world, the highest it's ever been. And the left, for whatever reason, just want the public to think that this is all some wild coincidence. 1 in 31 babies in America are now born with autism, down from 1 in 10,000 in the 1980s and 1 in 20,000 before that, meaning clearly something is going on that was not in the not so distant past. And now expecting mothers are finally getting some answers.
Acetaminophen, is that okay? Which is basically commonly known as Tylenol, during pregnancy can be associated with a very increased risk of autism. So taking Tylenol is not good. All right, I'll say it. It's not good. For this reason, they are strongly recommending that women limit Tylenol use during pregnancy unless medically necessary.
Okay, so the left are criticizing the president's delivery, but the message is clear. And the FDA and the CDC are now recommending that pregnant women avoid taking acetaminophen and certain vaccines should be given to infants now on an individual basis instead of mixing. If you've had babies or grandchildren, you know that there just comes a day when you go to the hospital and they just inject your child with multiple vaccines at the same time. That's called mixing. They say we shouldn't do that with certain vaccines. By the way, we do give certain vaccines on an individual basis right now. The chickenpox vaccine is an example of that. The CDC also changing the guidance on the COVID vaccine. It will no longer be recommended for healthy adults in this country. And joining us now for more on all of this is cardiologist and chief scientific officer at the wellness company, somebody who had their voice suppressed for speaking out about the vaccines during the pandemic, Dr. Peter McCullough. It's great to see you, doctor. Can you take us through this? The president says acetaminophen and Tylenol are something that pregnant mothers should avoid. They are trying to look into the connection between autism rates skyrocketing and what people are putting in their bodies. What can you tell us?
Well, let me say, Rob, that this is the first time a U.S. president has addressed the nation on autism since LBJ in the 1960s. It was an extraordinary press conference. You know, the two major things that were brought up in the press conference associated with autism are the use of Tylenol or acetaminophen and vaccines. Now, you know, a major reason why a pregnant woman would use Tylenol or acetaminophen is to get when she gets a fever after taking a vaccine. And vaccines have, you know, been used now in pregnancy for the last 25 years. Before that, they weren't used at all. And women are told to take Tylenol because if they get a fever, they could lose the baby. They could have a miscarriage. And they can't take naproxen or ibuprofen. So Tylenol during pregnancy is it's probably not the Tylenol itself, it's why the woman is using Tylenol. And in a paper by Prada and colleagues, 9 studies showed no link, and 4 studies that Tylenol is actually protective. So I think it's a mixed review on Tylenol, but now the focus really is on vaccines.
Okay, and doctor, there's something called the pathway to regression that we're learning more about. Basically, little kids' vaccine exposure for the first time under 3 years old, fever or seizure, you know, a trigger event, and then Tylenol is administered, and then there is a developmental regression, which could be autism that happens after that. Is that some of the connection that could be happening here between the 80 vaccines that kids are getting and Tylenol administered at young ages?
Yep, precisely. And the citation there, Rob, is Schultz and colleagues, 2008. After receiving the MMR vaccine, if a child develops a fever and gets Tylenol, there was over a 6-fold increased risk of autism. So again, the Tylenol is in response to the fever that's being generated from the vaccine.
All right. I want to ask you, doctor, and I feel like right now, and we've talked about this on this program, many others will still avoid this topic. It's the third rail, but it is the COVID vaccines, and it is long COVID and vaccine injury, which I think are essentially the same thing. But now here we are, 2025, almost 2026. Everybody seems to know somebody who is dealing with something medically that they just shouldn't be dealing with. Pericarditis, myocarditis, autoimmune diseases, cancer, cardiac arrest, death in some cases. Everybody knows somebody. And on Friday, The CDC vaccine advisors ended recommending COVID vaccines for healthy adults, shifting to individual decision-making for all Americans. The panel was unanimous, and it means that adults are no longer recommended to get the shot, except for people with underlying conditions. Is that the right move, in your opinion?
It's a step in the right direction. Now, many papers have called for the vaccines to be removed from the market altogether. Americans know the pandemic is over with. We have very good treatment methods now. It's not a significant risk. No one's taking these shots anyway, Rob.
Yeah. Can you, Dr. McCullough, a lot of people are concerned that have gotten the vaccine. Maybe they've taken two vaccines, or maybe they took, a booster, and they want to get the spike protein out of their bodies. What can people do? What can people do to get the spike protein out of your body? Because the protein is still, we know the protein is replicating long past when it should be. And millions of people are dealing with this every day, and they don't even know it.
Yeah, we have one patient in my practice now. He's in research, but we're using a lab in Germany. He has circulating Pfizer in his bloodstream and spike protein 3.2 years after the shots. This is far too long. Spike protein and the messenger RNA not broken down by human enzymes. So we use a combination of natural products that do break down the spike protein. That's nattokinase, bromelain, and added to that is curcumin. And there's a whole variety of products you can find on Amazon now that have, there's about 5 scientific peer-reviewed papers that support this in concept. We need large randomized trials. I hope RFK and HHS invest in spike protein research because so many people are suffering.
I think the demand is there, and everything that you just mentioned is over the counter. None of this stuff is, anyone can access everything you just mentioned. We'll post this segment as well, but I think, just final thought, do you think that this issue becomes a much greater issue at HHS and at the FDA and at the CDC as well under RFK Jr.?
I certainly hope so. RFK announced a $50 million autism study. That is far too small. The CDC is $9 billion in its budget, Rob. We should have hundreds of millions dedicated to autism. It's an existential crisis for our children.
All right. Dr. Peter McCullough, great to see you. Thanks so much for being with us tonight. We appreciate it.
Thank you.
All right.